The supplies and equipment needed for this demonstration include proper personal protective equipment such as gloves, mask, and eye protection, a suction device, and the appropriate size LMA. There are three primary types of LMAs: a straight LMA, a curved LMA, and the LMA Supreme. You will also need an appropriate size syringe for LMA cuff inflation, a water-soluble lubricant, a bag valve mask ventilator, a stethoscope, an end tidal CO2 detector, and tape or other device to secure the LMA. Before starting the insertion of the laryngeal mask airway, more commonly called LMA, first ensure you have on the proper personal protective equipment. It is important to provide bag valve mask ventilation to pre-oxygenate the patient and prevent hypoxia during preparation of the LMA for insertion. Next, select and examine the proper size LMA. A size 3 to 5 LMA will fit most adults. In this demonstration, we will use a size 4 LMA, which is designed for patients weighing approximately 50 to 70 kilograms. Before placement, test the LMA cuff by inserting air from a syringe to ensure there are no leaks. After verifying there are no leaks, deflate the cuff to form a smooth, flat wedge shape which will pass easily around the back of the tongue and behind the epiglottis. Beware that removing too much air from the cuff can cause it to curl and result in possible airway obstruction. Apply water-soluble lubrication to the back of the LMA just prior to insertion. Avoid excessive amounts of lubricant on the interior surface of the cuff or in the bowl of the mask. Also, be aware that inhalation of the lubricant following placement may result in the patient coughing or airway obstruction. Next, position the patient's airway by extending the head and flexing the neck. During insertion, it is important that the LMA not fold over, resulting in an airway obstruction. To properly insert the LMA, grasp the LMA by the tube, holding it like a pen as near as possible to the mask end. Place the tip of the LMA against the inner surface of the patient's upper teeth. Under direct visualization, press the mask tip upwards against the hard palate to flatten it out. Using the index finger, keep pressing upwards as you advance the mask into the pharynx to ensure the tip remains flattened and avoids the tongue. Continue pushing with your index finger and guide the mask downward into position. Grasp the tube firmly with the other hand, then withdraw your index finger from the pharynx. Press gently downward with your other hand to ensure the mask is fully inserted. Inflate the mask with the recommended volume of air. Do not overinflate. Do not touch the LMA tube while it is being inflated unless the position is obviously unstable. Normally, the mask should be allowed to rise up slightly out of the hypopharynx as it is inflated to find the correct position. Verify placement of the LMA by connecting it to a BVM ventilator and confirm with the end tidal CO2 detector. If properly inserted, the top of the device will change from purple to bright yellow. Ventilate the patient while confirming equal breath sounds over both lungs in all fields in the absence of ventilator sounds over the epigastrium. Insert a bite block to prevent occlusion of the tube should the patient bite down. Now the LMA can be secured utilizing the same techniques as those employed in securing of an endotracheal tube. This concludes the demonstration of inserting the laryngeal mask airway.